I just wanted to share that I'm one of those patients who did have a great deal of difficulty establishing my diagnosis. And what I think is kind of interesting with it is that I'm also a family nurse practitioner. So, in the
Hmm.
whole process of it, I was able to do a lot of my own research. And for what I usually say is, I kind of bulldozed my way into my diagnosis. So when I got my MRI back, I read it myself. I looked at all the images and I said, hey, what's going on here? Um, let's look at this a little further. Why aren't we doing the LP? Why are you ignoring me? Because my first neurologist was not a good neurologist. He literally ignored me for 2 months. Um, and I needed my ophthalmologist to essentially stronghold him into getting the lumbar puncture. Um, and what's kind of sad about it is he's just kind of like that anyway. But then I had a elevated opening pressure of 30. He didn't treat me. I needed to seek out treatment as well too. I was finally put on Diamox. And then I saw a neuro-ophthalmologist. And by the time I saw the neuro-ophthalmologist, my RNFL was low enough, but my optic nerves were still abnormal that she was actually questioning whether or not I had papillitis versus papilledema. So she didn't believe that I had IIH either, though I stayed on the Diamox and I developed pretty significant side effects on that medication to the point where I even had GI issues that caused fecal problems like incontinence and everything too. My neurologist, that was poor to begin with, when I gave him a list of all of my side effects with the Diamox, looked at me and he said, "What am I supposed to do with this?" It was extremely frustrating, and I obviously left in absolute tears because I'm just giving him my side effect profile of the drug. I was eventually put on Topamax, which caused severe cognitive problems, excessive syncope. I literally lost consciousness for 20 minutes at one point. I was still told that's not IIH related. My neuro-op, though, continued to refuse to refer me to neurointerventional radiology and neurosurgery. And all I said to her is, "I just want a consult." And she said, "Well, you don't have true papilledema. I don't think you have IIH." So I self-referred to Mayo Clinic, and it took about 2 months to get into Mayo Clinic. And the doctor I saw there was fantastic. I was off the Topamax at that particular time because, again, didn't have IIH, they told me. And I had papilledema. I had elevated OP. I had severe venous sinus stenosis that included the sagittal area as well. Empty cell. I had all the rad signs. I was textbook essentially, except I when I was treated, that papilledema was barely visible. I did have a stent placed on June 7th. So I'm just over 90 days, and the pulsatile tinnitus is completely resolved. None of the other symptoms have resolved. I'm off medication. I go in next week for my follow-up evaluation. I had 2 CTs over the summer because again, I was fainting and I was having severe pain at the base of my skull, and my cerebellar tonsils actually decreased, or they herniated post stent placement. So my brain kind of like dropped down about 4 millimeters, though I still have a little bit of CSF movement in there, but now I'm seeing a Chiari specialist next week as well too, to see what's going on there. So, when you talk about having a good neurologist, it is so, so important. And then having a good neuro-op, though, who's not going to throw that weight piece at you, because I've lost weight. And as I lose weight, my symptoms worsen, which is extremely frustrating to me. I've been off work because I can't function. I can't function around my house. I have a farm. I can't farm. My life is completely changed. I applied for disability and I've had doctors say to me, well, you're just giving up. And I'm like, I'm doing everything. I'm reading everything. I'm doing everything. I'm losing the weight. I'm doing everything that I possibly can. And it's just so incredibly frustrating. I did finally find a neurologist who treats my hemiplegic migraine, who's absolutely fantastic. And my hemiplegic migraines are finally controlled. But I still have numbness, tingling, paresthesias, hand cramping, loss of hand grip, that everybody says they don't know what's causing any of that. I was diagnosed with like cognitive issues, impaired processing speed, ADHD type symptoms. And 2 days ago was finally given a prescription for Concerta. And I'm on, like today's my second day. And that's really, really helping me finally focus because I decided I love to do stuff and go to school. So I decided to do a holistic wellness certification program since I can't do anything else. I would have to rewatch my videos 3 times just to get the information in. The information goes in and it stays after I do that. But I am not the same person that I was before IIH. And it was sudden. It just like my bucket tipped over in November, spilled, and I can't get it all together yet. It's awful, absolutely awful. So, I mean, I'm just really appreciative for the doctors who are out there and are really caring and are dedicating their lives to trying to help us.